and all the others watching our social.
77 countries have now reported cases of Omicron, and the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. Omicron is spreading at a rate we have not seen with any previous variant. We're concerned that people are dismissing Omicron as mild. Surely, we have learned by now that we underestimate this virus at our peril.
We have a number of speakers and experts.
Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems. I need to be very clear. Vaccines alone will not get any country out of this crisis. Countries can and must prevent the spread of Omicron with measures that work today. It's not vaccines instead of masks. It's not vaccines instead of distancing. It's not vaccines instead of ventilation or hand hygiene. Do it all. Do it consistently. Do it well.
At the blueprint here at WHO, we may have
evolving evidence suggests a small decline in the effectiveness of vaccines against severe disease and death, and a decline in preventing mild disease or infection. The emergence of Omicron has prompted some countries to roll out booster programs for their entire adult populations, even while we lack evidence for the effectiveness of boosters against this variant. WHO is concerned that such programs will repeat the vaccine hoarding we saw this year and exacerbate inequity.
simultaneous interpretation into 6 UN languages.
It's clear that, as we move forward, boosters could play an important role, especially for those at highest risk of severe disease and death. Let me be very clear. WHO is not against boosters. We are against inequity. Our main concern is to save lives everywhere. It is a question of prioritization. Who gets what vaccines in what order? The order matters. Giving boosters to groups at low risk of severe disease or death simply endangers the lives of those at high risk who are still waiting for their primary dose because of supply constraints.
Move on. We still have a long list of questions.
This is a highly transmissible variant. It's hard to stop it, but you can take the heat out of the transmission by doing the simple things: protecting yourself, protecting your family, protecting your community, avoiding crowded spaces, wearing a mask, ensuring good ventilation, washing your hands. And the governments need to support communities in doing that by putting in place layered measures that support communities in doing that and getting the health system ready. Health workers are exhausted. Many countries have lost up to 20% of their health workers. Health systems are weaker now than they were a year ago, in reality. So, unfortunately, sometimes you can get up after the first punch, but it's very hard to get up after the second and third, and that's the difficulty. We're relying on health workers and a health system that have been weakened by this response, and Dr. Tedros' concern is that we don't be complacent. We don't wait for it to be overwhelmed by a wave of cases. We have some time to get better.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.